So I want to continue this conversation on coronavirus, and I want to bring in Dr. Roger Klein. He's a former advisor to the FDA and the CDC. Doctor, thank you so much for joining us. So I want to start on something that I saw in your notes, actually. I've used the word alarming, I think, several times just in that last conversation with the mayor about these case count numbers that we've been seeing. But you wrote that the recent rise in COVID-19 cases is neither unexpected nor a cause for alarm. I'm sure I'm not alone in thinking that that is surprising. So why do you say that?
Hi, Kristin. Thanks for having me. First of all, I think we recognize that this virus is quite contagious and it's going to spread. And we understand and have understood that once people get out and start interacting, it's going to spread more, and that it's very, very hard to keep people from having social contact with one another. So I'm not really surprised by it. I tend to take a more positive view. I think the mayor is actually more typical of infections in younger, healthy people. And the risk of dying from this under 70 is actually quite low. And so I would rather say, I approach this from the position that we have a disease. We're saying it's more contagious than flu. Some people are saying it's significantly more contagious. And we can't stop flu by doing things like wearing masks or locking ourselves inside. I think what we need to do is try to manage the epidemic until enough people develop immunity through either infection or disease or an effective vaccine for it to burn out. And that means diverting infections, trying to those least likely to be injured or seriously ill by that, and to protect the vulnerable, and to do a really, really good job at protecting the vulnerable. For example, in nursing homes where 50% of patients have died, have regular testing and regular surveillance, and really jump on it quickly if there's an epidemic.
So then when you hear news, right, about reopening schools, this is something that has been pushed forth by the president. And you know what? Actually, Vice President Mike Pence also spoke about this today. I would like you to take a listen to what he had to say about this.
As we see to the needs of our states, as we focus on the health care of the American people, we're working to reopen America and to reopen America's schools. And yesterday, President Trump convened a summit of education leaders and health officials at the White House. And as the president made clear yesterday, it's time. It's time for us to get our kids back to school.
So you say we need to do a good job of managing this. Does this, policy of sending children back to school seem to run counter to that?
But it doesn't. I think so these are public policy, not medical questions. And I think we're balancing different considerations. There's two really important pieces to this. First of all, the children themselves are unlikely to be harmed by the virus. We don't have a lot of data, so we don't really know to the extent to which they're transmitted. It's probably no worse than adults. But I think, so we have to be concerned about that kids will, spread it to adults. But then we have to balance that against the harms that we're doing to children who are in school, and also we have to look at the daycare aspects of it, where people can't go to work if they have to stay home with their kids. I think we're looking at these considerations. We need to look from multiple directions at it. I think the idea that kids aren't going to get infected, or that they're not going to bring it home and infect parents is I think unrealistic. But on the other hand, what we should be doing then is making sure that we try our best to keep kids away from grandparents, for example, who are at high risk. I think doing more testing among the kids when they're in school so that we understand who's infected can help. But I think in general, we need to learn to live with this until it burns out. We can't stop life. And there are a lot of risks and harms to children not having them go to school.
All right, I want to ask you, I know you're a positive guy, so I want to ask you about some positive news, and that's around the vaccine. Moderna saying that it has now completed enrollment for phase 2 of its coronavirus vaccine study. I mean, does this kind of stoke more optimism that we could see a vaccine by January or the end of the year?
Well, I think it's possible. Moderna has some really cool technology that uses messenger RNA. It's new, it's novel, and it's quite exciting. But on the other hand, the idea that we're going to immunize the population, that we're going to have enough data to feel comfortable immunizing a bunch of healthy people, seems to me to be probably unlikely. The greater likelihood is enough people will become infected that the epidemic's going to burn out.
All right, Dr. Roger Klein, former advisor to the FDA and the CDC, thanks so much for joining us.
Thank you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.